Hello guys, hope you're all okay, you're all enjoying your life and you're also watching my videos. Welcome back to Dr. Arshad Nadeem Awan Ultrasound teaching videos. Today my topic of discussion is mesenchymal hematoma. Mesenchymal hematoma is actually a lesion with a mixture of bile duct and mesenchyma. It is the second commonest benign tumor in the children, and it is seen especially in less than 2 years of age. The peak incidence is 15 to 22 months. For the confirmation, there are three modalities available: the ultrasound, the CT scan, and MRI. On the ultrasound, it appears as a large, predominantly cystic mass ranging from 5 to 20 centimeter, and with the internal septation, with a solid component, and also with a gelatinous composition. This will appear on the ultrasound imaging, and it's quite easy to distinguish from the other lesions because of its large size and its particular appearance. Second thing is, as it is a common in children, so you won't miss that on the ultrasound imaging. As far as the CT scan is concerned, on the CT imaging, it is hypovascular. That's why it appears as a low attenuating, but in some cases, because of arterioventricular shunting, can be seen in large tortuously feeding vessels. So this is another point. The third thing is, this tumor will displace the major vessels. So on the ultrasonography, on the CT scan imaging, how it will appear and how you will differentiate and diagnose. So let's start watching these images to understand the mesenchymal hematoma. This is transabdominal scan, and on this transabdominal scan, mesenchymal hematoma is visible. However, its margins are not clearly visible on this particular image, but this is sitting within the liver parenchyma and its size is nearly 25 centimeter. As hematoma happens to be large and usually seen in less than 2 years of age, and it is made up of cystic and solid components. Because it's a mixture of bile ducts and mesenchyma, that's why the bile duct components will appear as an cystic, while mesenchymal product and constitution will appear as an solid. So therefore it will be a mixture mass, as you can appreciate in this image. This is a large, however we cannot define the margins, but it was actually a well defined large complex cystic and solid lesion, mixture of cystic and solid lesion, heterogeneous lesion. Its size was 25 centimeter and it was compressing the liver parenchyma and displacing the surrounding vessels. In this lesion there was no calcification. Making you more familiarized with the mesenchymal hematoma, here is the example again. This is a very large solid and cystic mass. In other words, it is a complex mass, or you can call it as a heterogeneous mass, having both components, the bile components and mesenchymal component. So that's why you can appreciate cystic lesions and some solid components as well. So this is a complex mass which is called as mesenchymal hematoma, and its size is 28 centimeter. It was child of 18 month with a complaint of distended abdomen, and when the ultrasound performed immediately on the liver, this mass was identified, and this is complex mass containing cystic and solid components. Whenever you come across with a large complex mass in a child, straight away jump to the conclusion, and that would be mesenchymal hematoma. It is very common in the children. This is another example of a mesenchymal hematoma within the liver. Surrounding the liver parenchyma can easily be seen. The liver margins can also be appreciated. However, so far this lesion is concerned, it's slightly complex and it is slightly different than the previous shown images. Here on this image you can appreciate some cystic and solid components, but it looks like it is septa, and the more you appreciate the internal feature, you will change your mind and it will look like it is a high dilated cyst, and that is grade 3 cyst, having a certain crumble membranes or floating membranes. So although this is not the case, this is actually mesenchymal hematoma, and this hematoma having solid and cystic component. As far as the cystic components are concerned, this are much greater than the previous one, so therefore the cystic components can be greater than the other solid components. However, this is a classical example of mesenchymal hematoma, and if you come across with such presentation, you must think of mesenchymal hematoma, because hydatid cyst, especially in the children up to that extent, is very rare. So therefore you cannot include that in your diagnosis because of the age factor, because of the size, and because of the occurrence of hydatid disease. So this is biliary, this is mesenchymal hematoma. Have a look for this transabdominal scan for the better understanding. Again, you are seeing this mesenchymal hematoma, and only another important feature is visible here, that is displacement of the surrounding vessels. So the vessels which are indicated by the white arrow are displaced. So this is a feature. To some extent you can appreciate on Doppler imaging. If you put the Doppler, so you will appreciate that surrounding vessels has been displaced, but on the CT images this would be quite clear. Again, I will give you the characteristic features of the this is mesenchymal hematoma, that it is made up of both solid and cystic components. Because of the presence of bile and mesenchyma, it gives rise to cystic and the solid components. So here this is a complex mass. It happens to be quite large, and at times when it presents, so it will definitely be enlarged because of the child cannot explain the things. The only presentation would be distended abdomen. When the patient presented with distended abdomen, and during the BLI ultrasound, if you perform the ultrasound, and ultrasound will pick this diagnosis easily, and this would be biliary hematoma. Then after this confirming, you can go further for the CT scan to confirm your diagnosis. A beautiful example of mesenchymal hematoma on contrast enhanced CT. This is a contrast enhanced CT axial image, and on this axial image you can see the presence of contrast, and aorta is showing contrast. As far as kidneys are concerned, kidneys has also taken contrast. There is contrast uptake, and the important point to be noted here, that is vessels are displaced. These vessels contain contrast which is surrounding and along the outer margins of the mesenchymal hematoma. Now come and look for the hematoma. It is a large mass occupying almost all the entire right lobe. Left lobe is bit visible, which you can appreciate because of the space occupying lesion. The liver is enlarged, so this is enlarged liver having a large complex mass in the right lobe. So there are significant cystic lesion, cystic areas which appears as an hypodense. So hypodensity and hyperdensity is clearly visible on CT image. So this is a classic example of the mesenchymal hematoma on CT, on contrast enhanced CT. This is another example of contrast enhanced CT for the detection of mesenchymal hematoma. Kidneys has already taken the contrast. There is uptake of contrast in the kidneys. Vertebrae are clearly visible. However, liver is completely occupied by a large hypodense lesion with having internal septation of soft tissue components. So these are internal septations. These are actually soft tissue components which you can appreciate. Some faint and some prominent septi can also be seen, which is differentiating these hypodense areas. So this is predominantly cystic lesions having internal soft tissue component. So mesenchymal hematoma may appear in this patient. So for the outer contour of the lesion is concerned, it is quite smooth and round in shape, and it has occupied the entire liver. So the liver parenchyma, you cannot comment, it confidently, because in this particular slide there is no liver parenchyma visible. So this is another example of mesenchymal hematoma. This is coronal image, and on this coronal image you can pick some of the points, like that how mesenchymal hematoma will appear on the CT images. It will include cystic areas and solid component which is visible here. The second thing, it would be a large mass, so this is large enough to occupy the entire liver. So on that particular image slides you cannot appreciate the liver parenchyma quite confidently, but the two things are, the one, the vessels are displaced. It is confirmed on that, like it is not feeding by the artery as it is benign lesion, so that's why it has no blood supply. It has only bile duct components and it has only mesenchymal components, so that's why it is a mixture. Otherwise, the second important feature is the bowel loops are also displaced. It has been pushed downward and backward, so this is another feature. So on this coronal image you can appreciate that the abdominal viscera has been pushed backward and downward. As far as the pancreas and other features are concerned, it has been pushed backward, but while so far the bowels are concerned, the bowel loops has been pushed downward, so because to give a space to this large complex mass, and this is mesenchymal hematoma. This is another axial slice. It is contrast enhanced CT axial slide, which showing contrast uptake in the right and the left kidney, and to some extent some of the area which is not visible on this image. On this image you can appreciate a well defined large complex mass including cystic areas and solid components involving most of the right and all of the left lobe. So this is biliary hematoma. Some part of the right lobe is visible here on this image, so you can appreciate the right lobe to some extent, which appears quite normal. Parenchyma is clear, margins are smooth. As far as margins of the liver and margins of the lesion is concerned, margins of the lesions are also smooth and there is no irregularity. Inside the inner parenchyma of the lesion include solid and cystic components, multiple solid and multiple cystic components. So this is another example of the mesenchymal hematoma on contrast enhanced CT. Yes friend, this was all about mesenchymal hematoma, and mesenchymal hematoma is quite easy to pick on the ultrasound imaging because of its large size, and especially is a common benign tumor in the children. As I mentioned that it's predominantly cystic with central loculations and gelatinous composition and septation both on ultrasound imaging and on CT scan. On the CT scan it appears as low attenuating, so you won't miss that. So this was all about, and hopefully this video will help you to understand the mesenchymal hematoma. With some other new videos, we'll see each other. Till then, take great care of yourself and keep watching my videos. See you then. Bye bye.